Hello, my name is Faustina Ikizi, and I am an LPN BSN student at Indiana State University. I am presenting asthma in children for my NAP 444 Clinical Health Education Project number 1. The population at risk for this presentation are children aged 3 and older who have high infection rates, live in low-income households, or who are overweight. Learning objectives. At the end of this presentation, learners should be able to differentiate between adults and children with asthma, determine the severity of asthma in children, identify the causes and risk factors of asthma in children, and create an interest in global childhood asthma prevalence and knowledge evaluation. This lesson should also help learners understand about pediatric asthma prevention and treatment options, prepare students to work in a pediatric department by teaching them about childhood asthma, encourages and inspires participants to raise awareness beyond the course, encourage learners to continue researching childhood asthma beyond this course, and finally expand learners' reasoning and critical thinking skills. You may pretext your knowledge about childhood asthma by clicking on the link. Let us define asthma. Asthma is a respiratory illness that affects adults and children. Essentially, the airway narrows, swells, and produces more mucus than in a normal unhealthy individuals, which increases difficulty in breathing. As a result, affected individuals cough, wheeze, and become short of breath. Asthma severity varies across individuals. Some individuals have mild symptoms and don't need immediate medical attention, while others need substantial medication to manage their asthma. Each asthmatic patient responds differently. Asthma in children is more severe than in adults, and it is uncommon. Signs and symptoms of child asthma. Childhood asthma is comparable to adult asthma. However, children's symptoms can vary. Major signs and symptoms include chest tightness, pain, coughing, wheezing, and shortness of breath. Asthmatic children are weak, tired, restless, and have difficulty eating and sleeping. They tend to avoid physical and social activities. Guardians should observe these symptoms and consult a doctor if children are exhibiting most of them. What are the general causes of asthma? Irritants like smoke, odors, air pollution, cold air, and chemicals. Also, allergens such as dust, pollen, pets, flowers, parasites are also triggers. Airway infections like pneumonia, flu, cold, and various sinus illnesses can also increase their chances of acquiring asthma. Emotional stress can lead to shortness of breath as well as increases the severity of other symptoms. Physical activities, sports, can cause shortness of breath. Therefore, asthmatic children need close observation during outdoor activities. What are the risk factors for childhood asthma? Biological factors, which include genetics and family history of asthma, predisposes upstream. Gender. While male children are more likely than girls to develop asthma, female adults are more likely than males. Being obese can cause airway obstruction, which can decrease their response to inhaled medications like corticosteroids. Asthma is also more likely to develop in children with low birth weight and chronic respiratory infections. Smoke exposure is also linked to asthma in children, particularly those living in overcrowded environments. Child asthma is also linked to pollution and poverty. Prevention of childhood asthma. Despite the many risks and causes of childhood asthma, preventing triggers and aggravating symptoms enhances quality of life, so preventive action should be emphasized. Achieving a healthy weight for the child because low weight and obesity are risk factors. Therefore, a healthy weight minimizes triggers and potential risks among children. Avoiding air pollution like tobacco smoke or spending less time outside when the air is bad is important. Also, encourage the child to be active. Essentially, any effort to control symptoms like use of inhalers to open area prior to exercise and control exposure to triggers will have a positive outcome. And follow up with up-to-date immunization like flu shot. Asthma complications. Asthma in children can cause numerous inconveniences through complications. Children may have permanent ineffective lung function if their asthma are not treated in time and adequately. Full-time alertness is required to care for an asthmatic child. Severe asthma episodes need urgent treatment, so caretakers must always prepare for these. Additionally, asthma problems disrupt daily life. Severe asthma may cause school absences. Children suffering with asthma lose appetite and sleep and have difficulty concentrating. Asthma management. Every asthma patient requires a management strategy, so guardians should schedule one with a pediatrician. The action plan is a proactive response to symptoms and promote well-being. Some of the recommendations include having a balanced diet and having access to medications, which, however, can be influenced by poverty and insecurity. Long-term and emergency asthma medication should be categorized. Antibiotics are used for long-term treatment, whereas nebulizers are used for immediate relief. Children's immunization should be kept up to date as well. However, caregivers must ensure emergency healthcare services are easily accessible. Asthmatic children may learn self-care techniques to help control their asthma. Children should be taught how to use and administer inhalers, and their usage should be carefully monitored. And finally, guardians should often check in their child's doctor to monitor its progress. Why do we have treatment failure in asthma? Incorrect diagnosis. To avoid misdiagnosis and mismanagement, one must closely monitor respiratory symptoms. Poor compliance. Medication use monitoring may show if a patient has been administered the medication. Also, observe how the child uses the inhaler and ask him or her to demonstrate. Home environment. If possible, a home visit by a skilled nurse may be extremely helpful in learning more about the patient living situation. Global challenges to child asthma. Globally, and particularly in underdeveloped nations, there is a wide-ranging lack of good primary care, which results in poor coordination of care between primary and secondary, therefore resulting in incorrect diagnosis and treatment failure, and patients may end up using private medication even if they haven't fully explored all of the usual treatment options. To summarize this presentation, this topic, children asthma, is intended for children aged 3 and above. Asthma affects individuals of all ages. While both male and female children are predisposed, males are more so. Asthma affects both adults and children with different symptoms. Asthma causes respiratory diseases and other issues in children. Nevertheless, prevention and control have long helped people live better. In spite of the comorbidity and other issues, asthma in children is manageable. Please follow the link to verify your answers. Follow this brochure link for additional information. And here are the references. And thanks for watching.